Care. Welcome everyone to this meeting of the Saudi Critical Care Trials Group. Thank you all for attending. Today we have another important presentation on research methodology, and this will be presented by my colleague, Dr. Hassan Durzi, who's the section head of medical ICU and trauma ICU at the Ministry of National Guard Health Affairs, an associate professor of critical care medicine at the College of Medicine, King Saud bin Abdulaziz University for Health Sciences. Dr. Hassan will be talking about a practical approach on writing the results and discussion section of the manuscript, very important topic, and we hope that we will have some discussion at the end. We'll hear from Dr. Hassan his practical extensive experience in this topic. Thank you, Dr. Hassan. Please. You can share your slides. Rose, is Dr. Hassan? Dr. Hassan, can you unmute Dr. Hassan? Dr. Hassan? Can you make Dr. Hassan host, please?
السلام عليكم.
السلام ورحمة الله. Dr. Hassan. تفضل.
طيب, okay. So let me share my screen.
We can see it now. It's good.
Okay, shall we start now?
Yes, please. Please, I introduce you.
Okay, I was sorry, I had some difficulty logging in. بسم الله الرحمن الرحيم. السلام عليكم جميعا. What we will talk about today is about how to write two sections of a medical manuscript, which are the results and the discussion sections. I want to be as practical as possible. Honestly, I think this presentation is better to be part of a workshop on manuscript writing. However, we are giving the presentation as a virtual presentation. And what I will do is that at the end, I will try to give you an example and try to to be as practical as possible. Writing the results and discussion sections usually follow having a proposal, and in the proposal usually we have reviewed literature about what we know about the research question. And so we have an introduction that is probably almost ready. And we also have written the methods section. And so these are almost done and could be part of a manuscript. So we have collected data, and we have analyzed the data, and now it is time to write the results and report our findings. And the results of a manuscript can be considered to be the center of the manuscripts, because all the roads lead to the results or come from the results. What I mean is that the introduction and the methods lead to having data and findings, and so results. And the discussion is, and the conclusions are dependent on the results. So the results section can be considered as the center or the heart of a manuscript. And so they are very important, or this section is very important part of the manuscript. Before writing the results section, what I would recommend to do two things. One is to review your objectives. So you need to go back to your proposal and review your objectives, because in the results you are going to focus on answering your objectives, whether they are primary or secondary. We have to focus on the primary on the primary objective, but if you have secondary objectives, we also have to answer the secondary objectives. And so we are going to either confirm or reject our hypothesis or hypotheses. So the research question had a hypothesis, so we did the study, and the results of the study are going to either confirm or reject the hypothesis that we had in our proposal. And at the same time, we should review our methods and our statistical analysis, and the results should be in line with the methods. We should not be talking about something that was not in the methods. Okay, we should not get distracted from answering the main objectives of the study, depending on the methods that we described in the proposal. So we need to review the objectives as well as the methods and the statistical analysis that we have performed. Usually when we present results, we can present results in different ways. So we can present them as a text, and we can present them in the form of non-textual tools, mainly tables and figures. And usually the most important results or data are usually presented in both formats, in the text format as well as through non-textual tools such as tables and or figures. Usually, we have limited numbers of tables that are allowed in a manuscript. It may vary from one journal to another, but usually most journals usually accept 2 to 4 tables to be part of the main manuscript or the article that usually you see whether online or in the paper journal. So usually, as I said, 2 to 4 tables are allowed in the main text of the manuscript. And usually journals allow 1 to 2 figures in the main texts of the manuscript. So we have to be probably selective in what information we put in these tables and figures. If the study has more information, and usually this applies to randomized controlled trials, where usually we have lots of information in the trials. So additional informations, we can present them in the form of additional tables and figures that can be submitted and will be in the form of appendices or supplementary material. So this will not be seen in the main article. They exist as supplementary material, and you can access these supplementary material. So this is about the non-textual tools for presenting our findings. The text of the results section is also limited. As you know, there is a limit for the word count of a manuscript. Usually it is in the range of 2,500 to 3,500 words for the whole manuscript. So this includes the introduction, the methods, the results, discussion, and so on. So we should also have we should select the information that we are going to present as a text in the results section, and this is why tables are very important, because tables will allow you to organize and display data more clearly than words, present specific information or exact values that are more difficult to present as a text. They function as a reference tools for readers, and also they help in the interpretation of findings and in comparing groups of data or information. So the tables have lots of advantages. And so usually when I start writing the results, the first thing I do is tabulating our data. And so preparing the tables would be the first step to do when we are going to write the results section. This is an example of a table. As you see, the table has a title that should be comprehensive and should tell me what the table is about. So this is an example of a table. So it has a title, and then usually tables has multiple columns and multiple rows that contain the information. And below the table, usually there is a footnote that has some additional information, for example, the abbreviations, or if there are certain remarks regarding the data. For example, if data are missing for certain variables, you can put them in this footnote. If you have, for example, an issue regarding the unit of a certain variable, then you can describe that unit in the footnote. So these are the main components of a table. So non-textual tools also include figures, and figures are also important to present data and results. They are more visual than tables, and they have many advantages, and they function to usually show patterns of data that are more difficult to present in tables or text, usually more difficult to present in text format. And usually they will display data more clearly than in the form of text. And also they help us in improving our understanding of results. Usually, as I said earlier, I start with the tables. Some figures are known yeah, from the start that they should be part of the manuscript. For example, if you are looking at survival, and so looking at Kaplan-Meier curves and survival, you have survival analysis. I think these figures are a given, so they are going to be part of the manuscripts. However, some other figures, maybe you will decide about them after tabulation of results and after thinking which data are better presented more visually in the form of figures. And so probably you don't have to decide about that at the start of writing the results section. So they may evolve with time as you are writing the results section. So the figure usually contains a title and usually contains also details about the figure. So if the figure includes some information about an experiment, so you have to specify the details of the experiment. And usually you should define what is in the figure. For example, if there is a bar or a line, you should say what is the bar and what is the line, what are the symbols in the figure. And also you may have to talk about the statistical analysis that you have done to reach that figure. So when you look at the figure and these associated information, the figure will stand alone, and so you are able to understand the information in the figure. So it's very important to have good description of figure. So I show you here multiple examples of different figures. This is a flow chart that is usually part of a manuscript on a manuscript of a randomized control trial. So how many patients we evaluated for entry into the trial, how many patients were enrolled, how many patients were excluded. These flowcharts can be also part of other types of studies, including cohorts or case control studies. This is a simple figure that it looks at the course of certain variables over time, and sometimes it's difficult to show all the information in a text format. So showing it in a visual format is going to be helpful to the reader and more interesting to the reader. So it will be maybe will increase the interest in writing or reading the manuscript by the reader, and also by the reviewer. These are also examples of other figures. This figure includes bars regarding percentages for certain groups of conditions or patients. And this is an example of a Kaplan-Meier curve. I think it will be very difficult to present all the information in such a figure in a text format. So the figure is very important and an easy way to present complex data. So now we move to the text. So after I tabulate data, so I put them in tables. Usually I have, I do multiple, as I said, usually journals allow two to four tables, maybe around 3 tables. So usually the first table is about, for example, the baseline characteristics of patients. And if we have 2 groups of patients, we say the characteristics of group 1 were this information, and the characteristics of group 2 were this information. So table 2 would be about, for example, what management was done for patients in group 1 and in group 2. And maybe table 3 is about the outcomes of patients, in group 1 and outcomes of patients in group 2. And for sure, we are comparing these groups. So usually we have a p-value in the column to the most right side of the table. So after I tabulate results in multiple tables, then I move to, so now I have all the results in the table format. So now I have to decide what information I'm going to put in the text format. So usually I should organize the text. And so what I recommend is to have subsections of the results. Usually, most journals usually are in favor of having subsections under the results section. Some journals do not require that, so you will have the text of results as multiple paragraphs, but I prefer that you select that you have subsections under the results sections. And how do we define these subsections? For example, if you are describing an experiment and the experiment has multiple phases, you're going to have the subsections depending on chronologic factors. So for example, phase 1, followed by phase 2, followed by phase 3. If I'm dealing with studies, for example, randomized controlled trials or cohort studies, then I'm going to have certain theme for each subsection. And these are examples. So for example, in this slide, the section is results section. Under it, the first subsection is usually talking about the characteristics of patients, okay? Who were the patients that were included in the study? And so we describe these patients. Usually we describe the baseline characteristics of the patients. And if we have multiple groups of patients, maybe depending on an outcome or depending on an exposure, then I will compare in this section the characteristics of patients in a text format. So if you look into this slide, and if you look at the first subsection, characteristics of patients, it's written that we enrolled 162 patients with invasive candidiasis, 120 patients from one hospital and 42 patients from another hospital. And then we put some epidemiology about them. So they presented 2.6 cases per 100 ICU admissions. And then I describe how about the diagnosis of invasive candidiasis. This is one of the articles we published some years ago. So the first subsection was about the characteristics of patients. And actually, what I advise you is that if you are going to be part of a team that performs research and maybe contributes to research sections, whenever you write an article, whenever you read an article, read it from this perspective. How am I going to learn from this article to help me in writing my next manuscript? Okay, so look at how people wrote the article, and this will help me and teach me how to do it myself for my study in the future. Okay, so read articles from different perspectives, including this perspective if you are going to be involved in research in the medical field. So the second subsection in this article was about the epidemiology of invasive candidiasis, so about different species that led to invasive candidiasis in ICU patients. And then there was a subsection about the management of patients with invasive candidiasis. How do we manage patients with invasive candidiasis? And the last subsection was about the outcomes of patients with invasive candidiasis. This is another example about the subsections of the results. This is a New England Journal of Medicine article. So as you see, there are subsections of the results section. So the first subsection would be about the patients, so characteristics of the patients. And then the subsequent subsections were about the primary efficacy outcome. And then there was a subsection about secondary outcomes, and then about exploratory outcomes and about safety issues in the trial. This was, I think, a randomized control trial. So these are the subsections in this article. So the subsections may vary from one study to another, but I think subsections will enable us to organize our data and results in a better way. Usually when we write the text of the results, the text should aim at stating and summarizing the main results of your study. And in this text, you are going to point out what were the important positives and what were or the negatives. Okay, the important positives and the important negatives are very important. For example, if you are comparing two groups of patients, it may be reasonable to state what were the characteristics or the outcomes that were significantly different between the two groups. So you, in the text, you point out to such information, the important positives or the important negatives. And if there was no significant difference, and this is an important finding, also we should point that out in the text of the results sections. The text should refer to the data presented within tables and explain them with focus on the main findings, as I said, and we should be as concise and brief. Yani, we don't have to say we had 200 patients that were males and 100 patients that were females. Okay, yani, there are certain informations that are probably will be redundant, and being concise is very important. So we should not put all the information in the text section, or all the information that are described in the tables in the text section. In the text section, point out trends also, very important, and reiteration of all numbers presented in the tables and figure is not recommended. So we should not repeat what exists in the table. Focus on the main results of your study. When we write the text of the results, use the past tense when describing your research results. For example, you can say patients in group 1 were older than patients in group 2. You don't say are older, you say were older. So you use the past tense. For example, if you have a figure in the manuscript, usually when we talk about that figure, we talk about it in the present tense. So for example, you say figure 1 shows this or that. Okay, table 1 describes or includes information about this or that. So these when we talk about such statements, we put them in the present tense. However, when we are describing our results, usually the results are described in the past tense. Usually when we put numbers, usually it's better to put the number and the percentage at the same time. Better, yani it's much better than only putting percentages. So I gave an example here. A positive signal was detected in 75% of the blood sample. This is not recommended, just to put the percentage. So the correct statement would be viral RNA was detected in 75% or 75 out of 100, for example, blood samples. Between parentheses, you put 75%. I gave you simple numbers, but the numbers can be much more complicated than this. So such a way of describing information is better than the other way, which is presenting only percentages. So keep in mind this. Don't use the word significant or significantly if there is no statistical difference. And so, for example, if the p-value is more than 0.05, usually you should not use the word significant when you are comparing two variables. Okay, avoid doing that. Try to be modest in your statements. So don't put definitive statements. So this definitely proves that, you know, so better to say this suggests or something. If you have noticed an unusual correlation between two variables when you did your analysis, you point out that in the results section, but don't try to explain this association in the results. This should be addressed in the discussion, not in the results. Okay, so try to explain why I'm having this more than that. Not, this should not be in the results section. This should be in discussion section. Let's say, for example, the mortality rate in group 1 was higher than the mortality rate of in group 2. So you're going to say that the patients in group 1 had higher mortality than the patients in group 2, but you're not going to say why this happened. Even if the Apache, let's say, severity of illness was higher in group 1, let's say. Okay, so this is not the place to say why I had such a finding. This should be addressed in the discussion section rather than the results section. Usually, we should refer, not usually, we should refer to each non-textual tool in a numbered order. So, for example, if we had 3 tables, table 1, table 2, table 3. Usually we refer to table 1 initially, then so when we talk about data that exists in table 1, we refer to table, the number of that table will be table number 1. So, and also we should refer to figure in a numbered order. Okay, so we should when we talk about the information, the information we talk about first, the related figure should be first, or should be before the subsequent figure related to subsequent information. Each non-textual element must be titled, numbered consecutively, and complete with a heading. I mentioned this earlier. We should have a good title for the tables as well as for the figure, and they should stand alone. So they should explain. So we should have information that explain these tables and figures so that the readers understand what they are talking about. And then at the end, I said that when after you write your results, I would go back and reread the background section and your objectives and see if you have addressed all the objectives of your study question. And so this is the end of the first part, which was about writing the results section. So next I will move to writing the discussion section, and then after that I will try to go through an exercise. So next is writing the discussion section. So the discussion section has a different purpose than the results section. So discussion section primarily focuses on interpreting your results, taking into consideration other studies that have been done in the past. And so your results may expand knowledge, may provide new information, or may support the findings of previous studies. So this is your results, and so we are going to focus on this in the discussion section. The discussion section is very important because it will help you to sell your study. For example, the reviewer or the editor will be convinced that your study is good enough for publication in the journal. And also it will allow you to convince the readers of the importance of your study and study findings, and that these findings are relevant to their practices. So discussion section is an important section in the manuscript. So before writing discussion, again, I would review the objectives of your study, the objectives that were in the proposal. And again, I would review the results and underline the main results of your study. So I will say, what are the main findings from my study? So 1, 2, 3, these are the main findings, and these are the main messages I am going to address in the discussion section. Usually, the discussion section is divided into 3 separate parts. Usually, there is an introductory paragraph. Then there are intermediate paragraphs. And then there is a concluding paragraph. So these are the 3 main parts of the discussion, and usually we have around 6 to 7 paragraphs. We may have less, we may have rarely we have more than that, but we may have less paragraphs depending. Each paragraph should not contain more than 200 words. So usually discussion section is around 800 words, 1000 words maximum, including the conclusion. So usually the first paragraph summarizes the main finding and the main messages of the study. Some authors may restate the main objective of their study before presenting the main findings. So again, I would like to advise you that when you are reading an article, look at how authors write the discussion section. And if you are doing research, this will help you to know how to write your next discussion section of your research project. And remember what I'm saying, and look at how people write the discussion. There is variation, but if you look at this, at many articles, you're going to that significant proportion of articles, the first paragraph of the discussion usually summarizes or points out the main points or the main findings of your study. And then in subsequent paragraphs, usually we should decide about what are the messages that we are going to address in the discussion. And usually I would put them in a logical order. Okay, so I have message 1, message 2, message 3. The order could be related to what was your primary objective of the study. So maybe I will address the primary objective in the paragraph on the top. So the message 1 would be about the primary objective of your study. But you need to be logical in the way you present the sequence of these messages. What I recommend is that start each paragraph with a sentence that defines the message that will be addressed in the paragraph. And then you talk about your findings regarding that message. And then you compare your findings with the findings of other studies. Was your finding different or new? Was it similar to the findings of other studies? So this is what you are going to discuss or write in these paragraphs. The other studies should be presented in a logical sequence. So usually from older to newer, or from studies, or initially we look at studies with a smaller sample size to studies with larger sample size. Okay, so you don't have to mention all the studies about the topic, but maybe you should pick the more important studies, or the studies that may help you in or support your study, or selling your study results. Avoid critiquing previous studies in details. Okay, we should not have lots of details in these paragraphs. So now I'll go back. Sorry. So try to explain your findings, and even if some findings were not expected. So you are trying to focus on your results rather than the results of other studies. So did your study confirm or deny or refute your hypothesis? Did your study findings provide an alternative hypothesis? What is the interpretation of your results? What are the possible mechanisms for your findings, maybe from basic science point of view, from pathophysiology point of view? Is there an explanation for your findings? What are the reasons that led to my findings being different than the findings of another investigator? So maybe it's related to the methods of my study that are different than the methods of another study. So this needs to be presented in this discussion section and in these paragraphs. If you have new ideas on the message or on the finding, you should put them in these paragraphs, and try to end the paragraph with a concluding remark. So here I give you an example from a discussion. And if you see the first paragraph, it said, in this large national study of patients hospitalized with COVID-19, obesity was associated with increased risk of admission to critical care, receiving mechanical ventilation, and in hospital mortality in all ethnic groups. So this study looked at obesity and its relationship to COVID-19 and the outcomes of COVID-19. And as you read from the first sentence, it was summarizing the main results of that study. So if you look at the second paragraph, it starts with, this study extends early preliminary findings from two different early analyses from the UK cohort study and another study. So they are saying here that our findings seems to be in line with the findings of two other studies. They are saying that the present study suggests that in patients admitted to hospital, a clinical coding of obesity is a stronger risk factor in Black ethnic groups specifically, rather than for the minority of ethnic groups in general. So here they are talking about their results. So this is another paragraph from another article that was looking at obesity in community-acquired pneumonia. And actually, in this study, they found that obese patients had better survival, and this is known to be known as the obesity paradox that probably you are familiar with. And so here, what so their finding was that obese patients had better outcome. Obese patient with pneumonia had better outcome or had better survival. So they are trying to explain such a finding. So they said, first, obese patients may have increased nutritional reserves, which may help mitigate metabolic and inflammatory stress. So they are trying to explain why obese patients had better outcomes than non-obese patients, and they usually think the usual thinking is that obese patients have worse outcomes than non-obese patients, but the finding is that obese patients have better outcomes. So they are trying to explain why they had that finding. So that first, this is maybe one reason. Second, some authors have suggested that casting of the thoracic cavity can reduce mechanical lung injury in the setting of pneumonia. So having maybe thick adipose tissue is maybe beneficial and protective as having worsening lung injury. So they are trying to say, because of that, maybe the outcome of patients is better. So I'm trying to explain why my finding was that. Then after I talk about the main messages in the of my study, then I have a paragraph that talks about the strengths and the weaknesses of your study. So you point out the limitations of your study. I think your study likely has a limitation. So it's much better that you point out that limitation rather than the reviewer maybe pointing out that limitation and maybe downgrading your manuscript because you did not discuss these limitations. So it's very important to know the limitations of your study and present the limitations of your study, usually in the paragraph above the conclusions. And if you have strengths, point out the strengths of your study. So here I give you an example about the paragraph about limitations of a study. So the paragraph said, our findings should be interpreted in the light of the strengths and limitations of the study. The strengths include the prospective data collection, the measurement of intra-abdominal pressure every 6 hours by a trained critical care nurse, and clearly defined clinical outcomes and so on. However, there are certain limitations. So it was a single center retrospective study. It had a small sample size. But if you can counteract that limitation by saying that I tried to reduce or that limitation by doing this, then point out what I did to reduce the limitations or certain biases, because many studies have biases. So try to say, or so say if you have addressed these limitations and you addressed these biases, try to say I did that to address the limitations or to decrease the effect of limitations on my study findings. This is another example of a paragraph about limitations. So it starts with saying that the present study has several strengths. Firstly, this is the first study to demonstrate prospectively the role of pulmonary embolism in the pathogenesis of COVID-19 patients or in patients without a clear suspicion. And so they are pointing out the strength initially, then they are talking about the weaknesses or the limitations of the study. Try to avoid these terms. My study is the first study and my study is the strongest study. We prefer not to use these type of terms, because many times we do literature review, but maybe our literature search was not perfect, and so maybe we have missed certain studies. Maybe certain studies are published in an search engine that we did not search into. So maybe we should be very cautious when we use these terms, and I prefer not to use these terms. So the last paragraphs in the discussion is usually for conclusions. Some journals usually have the conclusions as a separate section, but some of them it's part of the discussion section. It's last paragraph of the discussion section. Usually we start the conclusion by saying in conclusion, but this is not mandatory. In the conclusion, in the conclusion, we reinforce the main messages in our study. Usually, we try to avoid using cliches, certain sentences. For example, this problem needs further studies. So try to avoid such sentences. We may say that we need to evaluate the problem in a better way, or but try to avoid certain cliches or certain sentences like the one I mentioned, and avoid statements and conclusions that are not supported by adequately supported by your findings. So this is an example of a conclusion. So in conclusion, our study suggests that obese individuals with pneumonia, so look at the word suggests. So it is not, they are modest in presenting their findings, maybe because they had some limitations in their study. This was probably an observational study. So our study suggests that obese individuals with pneumonia are at significantly and substantially lower risk of mortality than normal weight individuals. Our study adds importantly to the reverse epidemiology literature Here they talk about the obesity paradox. So they reverse epidemiology literature about obesity and outcomes of certain conditions. Examples of used language in discussion section includes the following. A plausible explanation is that. One explanation is that it appears that these data suggest, these results may indicate. So look at this term, may indicate. Findings should be interpreted with caution. And during the construction of sentences, avoid unnecessary words and use active voice rather than passive voice. And this is a common finding, especially for the novice writer. Usually, we have very long sentences, and which will, when you read it, then you get confused. And so the idea will be unclear. So try to make the sentence as direct as possible and as concise as possible. Sometimes writing one sentence needs to be revised multiple times. And when I write one sentence, many times I have to revise it 5-6 times to use the most, to eventually reach the most direct sentence, most concise sentence that delivers the message that you want to deliver. And using the active voice is much better than using the passive passive voice. Some advice: avoid providing similar information in both the introduction and discussion sections. As I said earlier, usually the introduction has been already maybe done before. You may have to modify it when you modify the introduction of the proposal when you are doing the manuscript, but try to avoid duplication of information in both the introduction and discussion. Usually both should be complementary rather than being duplicate of each other. Avoid presenting new results in the discussion section. This is a no-no. Don't put new results in the discussion section that you have not presented in the results section. Avoid absolute statements and absolute verbs. Our study proves this is the only study I try to avoid such phrases. Avoid using exaggerating sentences about your study results, and avoid using shaky languages and hesitant sentences. And as I said earlier, avoid long and wordy sentences and wordy and long arguments. Use focused arguments and sentences. And this is the end of my presentation. I think what I'm going to do next is that I will go through an exercise. So I will share an exercise. Do you see the exercise, this sheet?
Yes, yes, we can see it.
Right. So this is better to be in a workshop, and so people are present in a classroom. And I'll try to start. And what's my advice is that I will put my email and so for people who are interested and want to complete the exercise, I suggest that they email me. And what I can do is that I can send them this exercise, and they can, if I am happy to review their homework and give them some advice. So this is so this exercise is as follows. So the background is that we have several observational studies in patients with acute respiratory failure that have found that obesity was associated with lower mortality. So you wonder if this findings applies to patients with severe COVID-19. So this is the research question. Are patients with severe COVID-19 or with critical COVID-19 with acute respiratory failure, is obesity a risk factor for mortality, or obesity is associated with lower mortality? Assume this is the research question. So is obesity a risk factor for mortality in patients with critical COVID-19 with acute respiratory failure? This is a research question. So what you do is that you perform a prospective data collection in patients admitted to ICU because of severe COVID-19 and acute respiratory failure. And so data analysis was performed using SPSS and is provided below. So I did an exercise and I provided results of data analysis using SPSS for data analysis. Okay. And so I have multiple objectives for the exercise. One, present the data in tables. Second, write the results section, suggest a figure, and write a paragraph that discusses the findings regarding hospital mortality in obese versus non-obese patients. This is the exercise I am suggesting. I think the setting of such a virtual meeting, this will be difficult to answer, to do the exercise. However, I'm going to start by looking at data and then starting to do tabulation and constructing tables. So this is the results as they come from SPSS. So this is a 2x2 table. And if you look at the columns, it said obesity, body mass, BMI, GE, which is my definition is greater or equal to 30. Yani 1 is yes, means that patients are obese. 1 means they are obese. Gender, I said 1 is M, yani 1 are males. So for example, 1 is are males. So I present the characteristics of patients. So I divide patients into obese based on body mass index 30 or more, and non-obese if the body mass index was less than 30. And I gave you the characteristics of patients. The first tables include the categorical characteristics, yani males and females, patient hypertension, no hypertension. And then the latter tables include the continuous characteristics, for example, age. So for example, in this table you are seeing 0 non-obese. What was their mean age was 61.07. what was the standard deviation? 15.758. The one with obese, their mean age was 58.35, and standard deviation was 13.9. And I have other continuous variables like body mass index, like admission SOFA score, like creatinine, like lactate, like hemoglobin, like INR. So first step of writing results is to summarize or put these data in tables format. Okay, tables format. So what I do is that I use Microsoft Word, and then I will say insert, and I'm going to create table. And usually for such results, I'm going to create a table that has 5 columns and several rows. So in the first column, I'm going to say the variable. In the second column, I'm going to say correct all patients. And in the third column, I'm going to say, for example, non-obese. And in the fourth column, I'm going to say obese. And in the fifth column, I'm going to say, and I'm going to put what was the p-value. This is a prospective study. Usually we present the p-value, or we compare the characteristics of non-obese versus obese, or obese versus non-obese. Okay. So for example, here, usually we start in the variable. So this will be table 1. As I said, usually table 1 usually talks about the characteristics of patients in the cohort. Okay, grouped by obesity. Let's say presence or absence of obesity. Okay, so this is the title of the first table. I'm going to say what variables I'm going to put. I'm going to put age. I'm going to put gender. I'm not going to fill the whole table, but for example, gender, I'm going to say how many patients, and so I'm going to say male gender. I don't have to say female and male. If I know who are male, how many were males, I know how many are females. Usually, this is the case. So in non-obese patients, which is 0, how many were male? Male is 1. So this is the male. So it will be this number. So it will be non-obese 133, and they represented 78.7%. So here I'll specify that these numbers are number, and between parentheses is percentage. So this means that this number between parentheses is a percentage. In the obese, how many of them were? They were 95 were males, and 70.4%. Total number of obese were, if you look at total number of obese, they were 135. It's here. This is total number of obese, 135. Total number of non-obese were 169. So we usually put it this way. In non-obese was 100, how much I said? 165? 169. And in all patients, n equal, what was the total number of patients? I think 304 patients. And so for all patients, how many were men? 228 were men, and then I put between parentheses what was the percentage, 75.0%. Okay, so this is how, and what was the p-value? if I'm comparing two categorical variables, so usually what test I use the chi-square test. The chi-square test usually I'm looking at this number. This is the number of the p-value, 0.096. So the p-value here is 0. I will not talk a lot about statistics now. This will be the p-value. And then I will complete this table. So I will go to the continuous variables and we'll say the age was 61.07 for non-obese. For example, here 61.07, and then I'll put plus or minus. And I will put also the age for the non-obese, the obese, I mean, it is 58.35. 58.35, and then usually for continuous variables, what is the statistical test we use to compare two groups? We use the student t-test. If you go to the table, you will find this is the student t-test. And usually we look at the Levene's test for variance. It's more than 0.05, so we go to this number. This will be the p-value. It will be 0.116. So I put it here, 0.116. Okay. So, and then this will be how I tabulate results. And I do it for all the variables. This is table 1. Then I have a section about outcomes. So for example, this will be table 2. Outcomes of patients in the cohort. Again, I construct a table. The same, 5 columns and multiple rows. And then I will look at what outcomes I have. So I have hospital death outcome. Hospital death, one means death. So this will be the death percentage. So in obese, their mortality rate was 59.3%. For non-obese was 45.6%. What was the p-value? So I put them in the table. What was the p-value? The p-value was 0.018, which was so p-value was less than 0.05. And then I have other outcomes, tracheostomy. I have outcomes, continuous outcomes, which is hospital stay and duration of mechanical ventilation. So I gave you the numbers, so we have to tabulate them. So this is the first step is to put my all results in tables forms, and then think about a figure, and then start writing the text of the results. So it's 10:20. What I suggest, if you are interested in continuing with this exercise, I am happy if you email me. I will send this document to you, and you can work on the objectives of the exercise. And I am happy to maybe review your homework and to help you in improving your skills about writing the results and the discussion sections of a manuscript. And this is the end of my presentation. If you have any questions, I'm happy to answer the questions. And thank you very much.
Thank you, Hassan, for this great presentation, and we'll open it for discussion. Could have a few questions. Dr. Yasser Shemmari, your hand is raised.
السلام عليكم دكتور حسن الدرزي. معك ياسر الشمري سوبرفايزر RT.
أهلين ياسر أهلا.
I'm interested into writing a manuscript. بس عندي سؤال الحين كل research we should write شو اسمه المانuscript على أساس الريزلت to describe the result. With discussion we should receive يعني read different articles to support our result at the same time. This is my question.
Yes, so you in the discussion section you are going to interpret your results, take into consideration other studies, whether they are in favor, they are along your results, or maybe they are against your results. So you're going to present both, the ones with and against.
Okay.
And you're going to say why my results are different than results of other people. Are my findings, are they more robust than the findings of other people? So I have the truth, or my results are the truth, and the results of other people are maybe false results, or maybe results that are different because of this reason. This is what you're going to do.
Okay, thank you so much, Dr. Hassan. Thank you.
Do you have other questions? Any other questions? Great presentation, Dr. Hassan, and really very informative about the results and discussion section. And thank you for your offer to help people in writing. If there are no more questions, I think we can conclude the session. Maybe give people another minute if there's any other question. I think also you highlighted very nicely that the very important that the results are put in the context or the finding and don't exaggerate your conclusion. Maybe could you emphasize this one more time, Hassan?
Yes, so we should avoid, as I said, we should be modest and we should not exaggerate our findings. So we should be very careful about what we say. Sometimes we don't recognize it actually. However, with time you will find it, and many times you get these comments from reviewers, and they maybe critique you for saying certain thing that seems to be exaggerating or definitive. You have a definitive statement. You may not recognize it initially, but then usually over time you understand that that sometimes you have to be selective in how you word your sentences.
Fatima, Ms. Fatima Dawood.
Thank you, Dr. Hassan, for the presentation. I have a question regarding the introduction and the discussion. You mentioned we need to try to avoid repeating the same information mentioned in the introduction in the discussion section, right?
Yes.
So I find it challenging because writing the introduction, we do it in the beginning, then we will write the discussion. So when we have a lot of repeated information, do you advise to rewrite the introduction completely, or trying to remove part of the introduction which might affect the coherence and the train of thoughts in the introduction? So which approach would be the best?
So from what I understood is that you're saying that I wrote the proposal, and
yes,
in the introduction I cited lots of studies, isn't it? And
yes,
then I'm going to write the discussion section, So what shall I do about the introduction? Should I remove some of the data that I present in introduction already, isn't it?
Yes.
I think this is what we should be doing, because usually when we write the introduction for in the proposal, usually we are trying to justify having the research question, and so we probably put lots of information in the introduction. So I think when we write discussion section, we maybe should move we should summarize the introduction and move some of the studies we referred to maybe to the discussion section. I think this is what should be done.
Okay, thank you so much.
Miss Rasha, is there a question by?
Oh, yes. Thank you, Dr. Hassan, for the presentation. Actually, I want to ask a question about when we are writing a pilot study, is there another protocol or tips we can add it in the discussion session, or it's just like as you mentioned in the presentation? If we are writing a manuscript for a pilot study, and we are wondering to publish it in an international journal, is there any advices or tips we can take and consider to write in discussion section? Or
with the pilot study is maybe a justification for doing a bigger study, isn't it?
Oh, yeah.
So these are usually when we do pilot study, we are trying to assess the feasibility of doing a bigger study.
Yeah.
And when we do the pilot study, maybe we detect certain difficulties we face, and this may affect maybe the doing of the main study. So I think these things I would try to focus on when I write discussion section of a pilot study.
Okay.
So
is it necessary to write these struggles in the limitation or with the paragraph?
No, I think these are very important points, and so probably they should be in the main paragraphs of the discussion.
Okay.
Because
okay,
you learned from these issues, and so probably this should be the focus of or a big focus of the discussion, because I don't think your main goal is
achieved.
looking at the results, because the results probably are not going to show much. Maybe you're looking at safety issues, feasibility issues, problems I faced. So these probably should be the object of the discussion, or the main themes in discussion. This is what I think is the right thing to do.
Okay. Okay. Thank you, Dr. Hassan.
Thank you, Dr. Durzi, for this excellent presentation. And thank you everyone for attending and contributing to the discussion. I think with this we'll conclude, and looking forward to meeting you next time. Thank you all.
Thank you very much.